Hey guys, welcome back to the channel. In today's video we will be talking about the pathways that you can go through in order to become a doctor in Australia. So in this scenario, just pretend that you've just approached the end of year 11 or starting year 12 and you thought to yourself that yes, you do want to become a doctor, and the first question which comes to mind is, how do I actually do this? Well, the first step is to get into medical school. So right off the bat, what you need to do for the first thing is to satisfy all the prerequisites to get into the actual degree. So for Adelaide University at least, these were year 12 subjects, so either chemistry, mathematical methods or biology. So secondly, you need to get a competitive UCAT score. So UCAT stands for the University Clinical Aptitude Test, and this is a test where you can learn strategies in order to do well in. So I would 100% not recommend to go into it blind and try and wing it, because it almost never works out. So if you get a good score on the UCAT, universities will often invite you to do an interview in order to screen you out from the other applicants. So at Adelaide Uni, I think it was around 500 applicants were selected based on their UCAT score. And at the end of that, and after the ATAR was taken into account, it's around 150 students which get into the program for that year. So talking about the ATAR, most of the time it's a minimum requirement to get above 90. But if you want to be competitive against the other applicants, you usually have to get 95 or above. So every university is different, but for example, Adelaide University, there's a different weighting for each of the things that you do. So for example, the interviews were 40%, the ATAR is worth 40% also, and the remaining 20% is the UCAT. But although the UCAT is worth the least, you need to do well on it in order to get the interview. So there's actually lots of people who are now in medical school who didn't get in on their first try, and there's actually a fair few different pathways to get past this. So the first pathway would be to get into another degree and complete the first year of that degree. And while you're doing that first year, you can do the UCAT again, and if you're successful, you can then transfer over to the undergraduate medical degree. And on a similar note, instead of getting another degree or getting into another degree, you could just take a gap year, do the UCAT, and yeah, try the process all over again. So the second way, I think it's the most difficult way to do it. It's the graduate entry pathway. So instead of transferring in your first year of another degree, you instead choose to complete the degree in its entirety. So you have that degree, it's usually a bachelor's level, and then you use your GPA and you do another test, which is not the UCAT, but it's called the GAMSAT. And this is a 5-hour test, and it tests your decision-making skills just like the UCAT, but it also tests your prior knowledge, particularly science. So I think it's a fair bit harder than the undergraduate entry pathway. So just to summarise, if you get into an undergraduate medical degree, you can do it straight out of high school, or you could do a gap year, or you could get into a degree, then transfer over. And all these methods means that the degree you get into is around 5 to 6 years long, just depending on which university you apply to. And the graduate entry pathway, it's a little bit more forgiving. So the medical degree that you get into is only 4 years long. So I knocked 2 years off. So this video has been good so far. It'd be great if you subscribe to the channel. So let's get on to the next part of the video. So you finally got into medical school, and this is what you can expect throughout the years. So assuming you're in the undergraduate medical degree, the first 1 to 3 years are considered preclinical. So what you'll be doing is learning basic clinical skills, as well as pathophysiology, anatomy, and some pharmacology. So basically the foundational medical knowledge that you'll need in your clinical years. Your clinical years are for years 4 to 6, and what you'll be doing is you'll be in hospital probably 5 days a week, and you'll be doing rotations just to get some exposure to the different specialties. So once you successfully complete the exit exams at the university and graduate, you are now registered with the Australian Medical Board, and it's a provisional registration. So you are now in your intern year and are considered a junior doctor. So as an intern, you'll have responsibilities to look after patients, but you'll also be under supervision. And since it's a provisional year, there's some prerequisites that you have to satisfy. So you need to do some rotations in emergency medicine, in surgery, and in other areas of medicine as well. The minimum service requirement is 47 weeks. So with the extra weeks that you have up your sleeve after completing the compulsory components, you can, ask to do rotations in areas that you're interested in. So if you're interested in pediatrics, you request more pediatric rotations. So once you successfully complete your internship, you now receive general registration with the medical board and graduate from being an intern to being a resident. So residency is similar to internship year, except that you'll probably have more responsibilities and more flexibility in what sort of rotations that you do. So doctors typically spend 1 to 3 years as a resident in order to gain more clinical experience and decide what specialty they want to go into. So once you decide what specialty you want to do, you apply for the specialist training program, and if you're successful, you now become a registrar. So depending on the specialty that you choose, the training program can run between 3 to 7 years. So in total, there is 16 medical specialty colleges to choose from, and the big ones would be FRACS CP, so Fellowship of the Royal Australian College of Physicians. So this college, you can basically think of anything which ends with ology. That's the thing you'll be looking at if you join this specialty college. And the other big one I can think of off the top of my head is the FRACS, which is the Fellowship of the Royal Australian College of Surgeons. So obviously this covers all the surgical specialties. So after finally completing the specialty training, you graduate from being a registrar to being a consultant. Yeah, so from this point on, the specialist can now go into private practice and practice independently. They can have their own Medicare number, or they could choose to do further subspecialisation in their field of interest. So thanks for watching the video. Hopefully that made things a little bit clearer for you. I kind of wish I had this video when I was in year 11, and I hope to see you around in the next video.